Hi everybody, this is Heather Lee and Ashley Cox, and we're presenting on cancer. So first we thought to go over just a general easy definition of what is cancer that most people know, and it's that it's a disease caused by an uncontrolled division of abnormal cells in a part of the body. And so we got some general statistics to give you an idea of different facts about cancer out there that they're finding. The first one is in 2015, there will be an estimated 1,658,370 new cancer cases diagnosed and 589,430 cancer deaths in the U.S. The next one is while more than half of all new cancers and cancer deaths are potentially preventable, anyone can develop cancer, with the risk of diagnosis increasing with age. So that's just to show that they're potentially preventable, but that's when they've been diagnosed, and anyone can have cancer. This one's from the book. It's 1 out of 8 deaths worldwide is due to cancer, and that one's, it kind of opens up your eyes to how cancer works and where it's at. And then the last one is the number of people living beyond a cancer diagnosis reached nearly 14.5 million in 2014, but is expected to rise to almost 19 million by 2024. And that was kind of a hopeful statistic we found to lighten the mood.
All right, so I'm going to talk about stages now. Breast cancer stages range from 0 to 4 with many different subcategories. Lower numbers indicate earlier stages of cancer, while higher numbers reflect late stages of cancer. And I thought this was interesting because I didn't even realize that there was a stage 0 and that it was an actual thing. So we're going to kind of use breast cancer as our example as we go over this. So stage 0, this stage describes non-invasive cancer. So if it were breast cancer, it would be ductal carcinoma, which basically it just means that there are abnormal cells which have been found in an area that a doctor wants to keep an eye on so that it does not progress. Stage 1, the tumor measures no more than 2 centimeters or about 3/4 of an inch in diameter. And it has not spread to any lymph nodes, and the cancer has not spread outside the localized area. So when it talks about stage 1, it could be either or both of these things while we talk about these. Stage 2, and it can be any or all of these 3 different things, but the tumor measures less than 2 centimeters in diameter, but has spread to lymph nodes under the arm, or the tumor is between 2 to 5 centimeters, which could be 3/4 to almost 2 inches in diameter, and may or may not have spread to the lymph nodes under the arm, or the tumor is larger than 5 centimeters, which is 2 inches in diameter, but has not spread to any lymph nodes. So any of those things fall under stage 2. Stage 3, a tumor of any size that has spread. So 10 or more lymph nodes under the arm, or what it has spread to. It has spread to the lymph nodes under or beneath the collarbone and near the neck, or it has spread to the lymph nodes within the breast itself and to the lymph nodes under the arm. So any of those things, again, fall under the category of stage 3. And stage 4, breast cancer has spread to the distant parts of the body, such as the lungs, liver, bones, or brain. And here's a quick picture to help you kind of understand the different sizes of tumors. I thought it was a good visual to kind of help.
And so we also made this slide, which is the types of cancer. But because cancer can be anywhere in the body, whether bones or blood or tissues, we kind of use this as our example to show body systems that are affected. I know that they have ribbons of different colors for different types of cancers, and this is just to get an idea that there's a lot more that go into each one of these. And so looking closer,
we've got some systematic symptoms here. Some examples of local signs and symptoms of various cancers include cough or shortness of breath with lung cancer, feeling a painless, or in other words, a non-tender lump in the breast with breast cancer, bloody stools with colon cancer, bone pain with bone cancer, difficulty swallowing and or heartburn with esophageal cancer, headache, seizures, muscle weakness and or nausea and vomiting with brain cancer. And then here are some of the most studied risk factors. There are age, alcohol, cancer-causing substances, chronic inflammation, diet, hormones, immunosuppression, infectious agents, obesity, radiation, sunlight, and tobacco.
Okay, so we included treatments and their effects to kind of give you an idea of what your clients may be struggling with after they get these type of treatments. So the first one is the effects of surgery is sometimes vomiting, weakness, profuse sweating, loss of appetite, weight loss, fatigability, and pain. And then with radiation, some of the effects is that infections become life-threatening issues due to low white blood cells in the counting of blood cells. And then chemotherapy can sometimes have bleeding episodes and hair loss. And then we tried to think of how the role of the TRS is affected and TR implication is affected through cancer clients. And so we just made this slide of how to assist them. So every cancer is different, so it has different effects like we just talked about. And it mentions in the book that clients may need physical, rehabilitative, psychological, and social assistance. So depending on which specific cancer or treatment your client has had is how to adapt the activities to them. So if they've lost a limb to amputation because of the cancer, then you have to address that differently. And so each cancer is different, and you just have to be aware of that.
Something we just really want to stress is that cancer happens to every single person at any single age at a given time. It doesn't matter. There are just so many different things that can happen, and it can happen to anybody. And so we found this video. It's just kind of like a day in the life type of video to just really illustrate what it is like for a young child who is dealing with these kind of symptoms that we've been talking about. So.
Cheyenne has always loved playing in the mountains and being in the mountains and doing all kinds of outdoor stuff. She loves to read, so we read to each other all the time.
I like to do crafts and other fun games with my brother. I can only go an hour away from the children's hospital, so that really stinks. I am Cheyenne Dias, and I have T lymphoblastic lymphoma. I never really remember getting told, Cheyenne, you have cancer. I just could feel inside me that it wasn't right.
We went from a cyst, which it wasn't, to a severely life-threatening condition. So it was very fast. They needed to fight for life to get her to the Children's Hospital in Denver because her trachea was in such a precarious state.
I got on the helicopter, said goodbye, and that was that. The next step was to get me chemo immediately.
When they said it was a 2-year treatment plan, what that means is if you can go 2 years straight through of chemo, you'll be done in 2 years. What we've since learned is
that nobody can go 2 years straight through.
The resilience of Cheyenne through all of this has been amazing, but the hardest part is all the other stuff. You know, it's 16 different kinds of chemo, it's steroids, it's side effects from all of that, plus the side effects from the medicine to take the side effects off.
We had a slight interruption. We are sorry. We're going to resume the video now. Please enjoy.
From all of that, plus the side effects from the medicine to take the side effects off.
There's nothing more important than funding the research, just to help her and to help all the other kids that don't know it yet, but will have to face that same challenge.
I found out about St. Baldrick because of the head shaving event in March. Seeing people shave just for fun, it just made me feel amazing. Like, I didn't know what to do or say. It was awesome.
She's already beat the odds on lots of stuff. She beat the odds in how long she was going to be in the hospital. Her tumor went away, but beyond that, anything that a parent wants for their child is to just be a healthy, happy kid that turns into a healthy, happy adult that lives a long, healthy, happy life.
I want to be a pediatric oncologist and help kids out that have gone through what I've gone through.